So up next is Timothy. Hopefully he's here. He's another member of the Better Breathing Choir. He's a fourth-year medical student at Memorial University of Newfoundland and holds a Master of Health Ethics from Memorial University, a Master of Music from the University of Florida, and a Bachelor of Music honors from Memorial University. He is actively involved in research, and notably, he recently presented his involvement in the development of Examun, I hope I'm saying that right, an app designed for medical residents to engage in self-reflection upon their day-to-day performance in clinical work at the International Conference on Residency Education. Outside of medical school, Timothy is an ethicist on the Newfoundland and Labrador Health Research Ethics Board, a volunteer coach with the Special Olympics, and he has worked with the Better Breathing Choir and LADA, a neurodiverse choir belonging to the Shalloway organization in Newfoundland. So thank you for being here, Timothy.
Yes, thank you for having me. I'm just going to share my screen. Okay, is everyone able to see my screen?
Yep.
Okay, and you can hear me okay. All right. Oh, thank you so much for having me here today and for that really nice introduction. So I work alongside with Jane at the Better Breathing Choir, and so this is a small scale sort of pilot project that we had started recently during the pandemic, that Jane and I were interested in this particular question. So the title of the project is Why Are Health Choir Members Motivated to Join and Continue Their Participation? And so we think this is a really interesting question and we'd like to explore it further. So my presentation is going to talk about this project and what we're doing so far. So as I'm sure most of us are aware of the variety of different health choirs that exist, I work with the Better Breathing Choir, which is for respiratory issues, as Jane talked about. There's multiple different other health choirs for people with mental health issues, neurological issues like Parkinson's disease, cancer, patients and survivors. So there's numerous different types of groups. And so the benefits that participants of these groups get somewhat vary, but within the health choir literature, there's been some kind of general benefits that have been noted so far by people who work and with these particular groups. So some benefits that have been noted so far are physical benefits like improved breath control and capacity, increased vocal strength, mobility improvement, psychological benefits from participation in these choirs like improved mood, ability to cope with stress, and social benefits as well, such as connecting with others, making friends, sharing experiences with others who share the same condition or have gone through the same experiences. One of the things that we're interested in looking at too is whether or not these benefits are actually motivating participants to join health choirs and also continue their participation in health choirs, which is a little more of a sort of a nuanced question rather than asking what are people getting out of the choir. Are these benefits actually making them sign up for the choir and come, and what is motivating them to come each week to rehearsals? So what we've done so far, so this is really our kind of our research question, and sort of twofold. So what I said is, what factors are motivating participants to join the choir and their participation, and to what degree do these factors motivate the individual's participation in health choirs? And another thing we're interested in too is, are factors that motivate joining and continuing participation in health choirs the same or different? Which again is some more nuanced question too. And then we feel that it's really important for health choir directors, members of health choirs, and those who work with health choirs. This information is really important as it helps individuals structure choir sessions based on what participants feel are motivating them to come each week, what participants would like to see in order to motivate them to come each week, and also for recruiting new participants. How can it sort of helps, it will helps choir directors sort of target their choir and market their choir to potential participants. So what we've done so far is we've done an online Qualtrics survey, which we've now distributed to 2 health choirs, the Better Breathing Choir in St. John's, which is the choir that I work with. And also we've done sort of Singing with Parkinson's in Toronto, which I'm sure some of you are aware of this choir too. And so what we've done is we've based the survey on the physical activity and leisure motivation scale, developed by Morris and Rogers in their paper. But what we've done is we've adapted this scale, which was mainly done for participation in exercise and physical therapy programs. But we've modified this to fit the health choir demographic by including questions regarding warm-ups, musical factors that may be influencing participants' motivations, such as the particular songs choir sings, particular singing exercises, as well as we've also included questions regarding the social aspects of participation in the choir, which were not originally in the scale. And we've also included some additional sort of open-ended questions in our survey to gain more nuanced and further insight into factors that we may not be covering in this particular scale that may exist. So far we've had a small number of respondents so far. We've had 8 respondents in total from the Better Breathing Choir and Singing with Parkinson's. So far what we're doing is we're using more of a qualitative analysis employed to determine the strength of motivating factors based on how many individuals rate particular factors as a strong motivator or a weaker motivator to participate. So what we found so far is that the strongest motivating factors for both joining and continuing participation is emotional benefits like mood improvement, for example. Again, the social aspects of the choir we found are really important for people, getting people to come back each week, such as singing with others, spending time with others in the choir, also meeting new choir members and other people. Vocal strength and fitness improvement was another big factor, which I mentioned earlier was a benefit, but it seems that a lot of the people who are responding have noted this as a motivator. Also, singing skills improvement as well has been noted as what our survey responded so far as a big motivator, and also breathing exercises and improvement. What we found is also some weaker motivating factors, so not as strong as those for getting people to come each week and joining the choirs, are friendship formation and being with friends, support from others with same or similar health issues, physical health and physical fitness improvement, and also stress reduction as well. With regards to continued participation only, it seems that our respondents so far are really enjoying singing in a health choir, and the enjoyment they get out of participating and coming each week is getting them to come back. Maintenance of singing and musical skills, so the skills that people are learning and developing in these choirs, is a desire to continue building on those skills and maintaining those skills is another motivating factor. And also we found that songs that the songs that the choir is singing and musical aspects of the choir is also a strong motivating factor for continued participation. One weaker motivator was communication ability improvement, which was on the original POM scale. We had left that in there as well to see whether or not that would be a motivating factor, but that's not as strong as we not as strong as the other factors that I have mentioned so far. We also asked participants as part of the open-ended questions, the most meaningful aspects of what is the most meaningful aspect of their experience in the health choir so far. And so far, what we found is that camaraderie and the pleasure derived from singing in the group are perhaps the strongest motivating factors of what we've seen. And we also were interested as well because we were surveying choir members during the pandemic. And as Jane had just talked about with the hybrid model, we have participants participating online. And in person as well. So during this time of hybrid participation and mostly participation online previously to the hybrid participation, what was motivating people to come each week to the choir? And we found that the desire to connect and be with others was a strong motivating factor, which given the isolation that many of us experienced during the pandemic, this is not a surprise. So to kind of summarize these results, so far these results are largely confirming our expectations based on the benefits that I have mentioned previously in the presentation that have been noted that participants have gotten out of health choirs. So we were expecting that many of these benefits were motivating factors as well. So we were also, motivators that, as I said, were unexpectedly weaker, as I mentioned, were some psychological benefits like mood improvement and also support from others with the same health issue. So respondents so far have noted that it's not necessarily, perhaps it's not necessarily connecting with others with the same health issue, but it could be more due to the fact that they're just connecting with others in general and being in a group and singing with people who have a shared interest, and is more motivating than actually the health issue that's that they originally joined the choir for, really. And kind of as I had alluded to earlier, these results will have some implications for how health choir directors structure sessions to keep participants coming back. And Jane has alluded to as well the implementation of a social prescription system. So if we're able to determine what motivates people to come to a health choir, other healthcare professionals like doctors, nurse practitioners, and others can recommend a health choir participation based on patients who they feel would benefit from this participation based on the motivators that they, based on the motivating factors that the health professional feels that that their particular patient has for participation in such a choir. So there's a broad range of implications there. So far, just some limitations so far. So far we've had limited response to the survey. So these factors may change over time. And so far responses are limited to the experiences of 2 choirs. Given the variety of health choirs, motivating factors may change and may be different in other choirs that we just have not uncovered yet. We did modify the scale that we have based our particular survey on. So we included some motivating factors that we had thought would be motivators, like singing, like particular songs, as well as the musical factors of choir participation. As well, the influence of the COVID-19 pandemic may have influenced some answers so far based on being isolated at home and not able to come to a choir may be influencing people to say that their desire to be connected with others as a strong motivator might be motivated by that, but by just the sheer circumstances of the pandemic and not being able to leave. And also what we found is that there's a relative lack of comparison studies available, which are looking at motivating factors rather than benefits. That certainly leads into the future steps and where we're going with this project. So we're planning to survey additional health choirs, also, and making this sort of a larger scale study and having similar larger scale studies coming out of this. And also one thing we're looking at is developing an additional survey for health choir directors, to get their perspective on what they think participants' motivating factors are as well. To again get a more nuance, get another nuanced perspective rather from the participant side, rather what the directors think might be motivating their choir members to come as well, and sort of comparing those results to this project will be an interesting question going forward. So thank you very much. I know I had some limited time today to talk, but I hope that gave a good overview of sort of where we're going with this. And does anybody have any questions so far?
Tim, there is a question in the room.
Hi. Thank you for your talk. And it's Annabelle Cohen here, and I'm interested in the issue of males' attitudes to singing. Because from the age of 6, males have negative attitudes to singing. And this may be less so for older males because it may be a more modern phenomenon. But I just wondered if that would enter into the motivating factors in terms of who is joining choirs. And of course, with the older demographic, there are actually proportionally less males too to choose from. So who might participate. But I just wonder if that is a factor.
Absolutely. So I didn't get a whole lot of time to talk about this, but our survey, we're also controlling as well for demographics like age, gender, previous musical experience, whether or not they've had previous choir experience as well. So we definitely are looking at the role that gender plays on the plays on the responses and the motivating factors as well, because we are that's one of our demographic questions, and we're one of the things that we're interested in too. So absolutely, yes. And what we found so far is that most of the respondents were actually have been female so far, or female identified participants, I should say, so far. So definitely, that's certainly something we're looking at going forward.
I think I saw Meryl Tanner's hand up.
Hello, can you hear me?
Yes.
Yes.
It says that I'm not allowed to unmute myself. So I'm not sure if people can hear me or not. I can see why Jane was having. Anyway, I'm hoping you can hear me. I'm a speech pathologist and a singer, and I did my PhD in vocal strengthening in the form of a choir for people with Parkinson's disease. And I'm just thinking about your questions when you've modified the palms, and I don't know the palms, but it may be that even within your Parkinson's choir, communication is not an issue for them yet, so then it wouldn't be a motivating factor. So it may be in, and maybe not in the breathing group either, their communication isn't their issue. But what I find is there are, if communication is an issue, it is a big motivating factor for participation. So I wouldn't discount it unless you have already looked at who has a communication disorder, right?
No, and we're not discounting that yet. But it's just so far. That's the response that we've received so far, and like I said, that might change over time as we receive more and more responses. This is just what we've done so far with the project, and absolutely, we're not discounting anything yet.
I'll just add to that, if the sound is okay. I think also where the referrals come from might be an interesting variable to look at. They're being referred to by their primary care doctors. Find
I had a bit of trouble hearing that.
I had trouble hearing that as well.
Yeah. Something about doctors referring.
Yeah, just,
Good point. Till we fix it, I think, yeah, I don't know if we
You
can,
can go ahead. I
Okay.
just need a Meryl. It was picking up the feedback
Can-
from her.
can everyone hear me okay now?
I think so, yes.
Okay, I was just saying that the referral process might also be a variable of interest to see where people are hearing about the choir, if they're hearing about it through a speech language therapist that's referring them to choir for the vocal outcomes, that it might be a more motivating factor. So to take note of that in future studies.
Absolutely, yeah. And again, there's so many different avenues to explore with this. So we're hoping that this is just a springboard to other research questions and other studies as well.
It's super interesting work. Thanks so much, Timothy.